I'm Jeremiah Simmons. I graduated from Sauk Rapids Rice High School, and I graduated back in May of 2020. The way I got involved in the CNA program was, well, first I volunteered the summer prior to starting because I knew I wanted to become a CNA, but I was very unsure how to do it and where to go to become a CNA. And then the following school year in the fall trimester, I saw that there was it was like a job offering on our Schoology page to do the paid training for it and a test out with the state of Minnesota. So that's how I became a CNA, was through that paid training. I was really happy that I saw it because even though I did the 40 hours of volunteer work, I was still unsure of how to actually start in the program there. I was interested because I knew I wanted to become a nurse, and I was like, I should really start soon to get into that field and to see how it is. Because I was working at Target. I worked at Target for a good year and a half before I worked for St. Benedict. And I was like, if you know you want to become a nurse, it may be beneficial to kind of get in that field and get that experience. So that's why I became a CNA. From my experience from the past 2 years, it's been a lot. It's been changing with the pandemic, but overall, it's mostly caring for the residents and also being there to make sure that they're okay and they have someone to talk to, and also helping them with their daily ADLs. And that includes like bathing or walking, eating, and watching TV, like things that that we all do on a normal basis, and we help them out with that, along with being there for anything they need. It's really nice. I like it. It's really a good job. I love it. With this job, it feels like I'm able to connect with them on a much deeper level and learn so much from them. And with nursing, I've been able to learn things here and there as well, especially with working on like a short stay unit at St. Ben's. We get lots of people from the hospital, and you just see different things, and also you learn different things with the job. And it's very fascinating, and I just really like that you are able to sometimes get unexpected things happening to you all the time. And also, I've been able to see different things that keep pushing me towards nursing because I just love the job. And as you see what the nurses are doing, like leg wrappings and different things like that, you're able to learn more and more. And also, you're able to back that experience up once you do study nursing. So the process with the technical college that I've had from enrollment was kind of just doing my prerequisites, and also you do have to take the TEAS test to get into the program. And then after you have those two big aspects done, that's when they look at your GPA and also what you scored on the test, and then see from there for the program. And it is a little bit stressful because you do want to have a good GPA and also a good score. So it's lots of studying that is involved. But that was kind of my take from getting into the program. And I know I did like a summer semester and with classes and such. But yeah, I mean, I didn't find it too rigorous. I also found that I was able to get help from CareerSTART and also from the counselors at the tech college. Okay, so the LPN program is the licensed practical nursing program that they have there. It's a 2 semester program, and I start this spring semester. So this spring would be my first semester into the program, and it would go on to the fall semester, and hopefully I can have my LPN around December of 2021. But with this program, you are able to learn the aspects of nursing, and also you won't be a like registered nurse, but you'll be a licensed practical nurse, and you'll be able to practice the basics of nursing and what there is to do. And then on from the LPN is when you can go just back for your second year of nursing and get your ADN. And that's essentially a 2 year nursing degree. The ADN versus the LPN is basically you go back for another year, and then that's when you add on to what you did learn in the LPN. And at the tech, you do work a year as LPN, so you can have that experience for the ADN program. And with the ADN, that's kind of like, that's more towards a registered nurse, but it doesn't have the BSN part. And that's just, it's a factor of, I want to say, 15 class credits, and most of it is kind of like communication work, I'd say, from what I've heard. And you can go on to like online program for that BSN part, because a lot of it is like admin and also public health studies and things like that, that the tech doesn't do essentially, because they're more focused on the nursing part. But for the most part, the nursing is what's really taught in the ADN, and it's more advanced nursing. I was thinking of going to Alexandria Tech for their ADN program, since you don't have to wait a full year to work as an LPN. And I was also looking at some other schools like Central Lakes or Anoka Tech for after getting my LPN to do the ADN program. And then from there, I would like to get my bachelor's in nursing. And I know that SCSU and also SMSU, they have a online program that you can get that through. I know a couple of nurses who have done it online for those last credits of nursing, and that's kind of my plan from there. My end goal would, I would like to have my master's in nursing. I would really like that. I would like to become a nurse practitioner. Oh, I would love to work in pediatrics because I do like kids a lot. I was thinking of becoming a teacher for nursing, and I was able to, luckily, there was this program through the Chamber of Commerce. I worked at the YMCA in the Rainbow Room, kind of, and it was working with lots of children. But I was like, I don't know if I want to teach children, so I kind of did veer away from that. But I would like to work with children in nursing because I just feel like I've always had a special connection with it, and I always have wanted to kind of work with kids. And I was like, why not just pair the two together? I think that if you are interested in healthcare and you may not quite know what you want to be in healthcare or what you want to do right away, I do think that becoming a CNA is a really good factor, because with being a CNA, you can do lots of things within the healthcare. So, kind of like right now, we have CNAs who are getting trained to do the swabbing testing for COVID. You also have CNAs who work on the COVID unit. And at the hospital, you have the CNAs and PCAs that they do a lot more different aspects, like they do bladder scans, or some actually at different facilities might actually pass medications as well. That's, it's a TMA, but it's essentially still CNA, but you're able to kind of build on top of that. So with being a CNA, it's a lot more than just being a care provider. You're able to learn from it and also do different things with being a CNA. And with the healthcare field, there's so many things in it. It's such a vast field that you can kind of do anything in it. So if you don't know what you're doing, or you do know what you're doing, being senior will give you that experience that you may not get at a regular job. It is a really good field, and you can also make a lot of good money with working as a CNA, because it's a really high demand job, because facilities need CNAs to, provide care for the residents and the patients of their facility. But with being a CNA, you can, especially with having COVID, but most start at 15 plus for the base pay, because it goes by base, and then it goes by shift differential, and then it also goes by if they are in such a need that they'll, I know where I work, we're able to pick up any shift that we pick up 3 days ahead of time. So if I picked up a shift for Saturday or for Sunday or Monday, I would get time and a half pay for that shift. So I know for me, because I've been at St. Ben's for 2 years, if I pick up any shift, I make roughly $25 an hour plus because of that, because I have my base pay of 15, and then I also get $4 extra for my shift differential of working the overnight shift for it's $3 for evening, and then you also have the time and a half. So you really are able to make good money. So with being a CNA, that's a big factor as well, and also you are able to work a lot more longer hours. I know I work lots of 2 p.m. till 7:30 a.m. shifts, so I work kind of doubles all the time, 2 8-hour shifts. So with that, if you might be in school or you might trying to save money, it's a really good factor that you are able to work longer hours and working at maybe, Target or Walmart. You are able to work for longer hours and also work them with your schedule more because you can become casual or every other weekend, and you can pick up to what kind of helps you and also what fits into your schedule. Hi, if you're interested in supporting Career Start, this is how you're able to help others trying to become a CNA with their CNA program. So, with donors help and also with community help, you're able to help cover tuition costs for the program. Also, you're able to help cover for scrubs and shoes. And you also are able to help cover the CNA test through the state of Minnesota. I know when I became a CNA, I did have to pay out of pocket for my shoes, for my scrubs, for my watch, and also I did have to pay to go to the CNA test as well. So to have those factors to help someone new become a CNA, it kind of does help them with getting into a different career field, as well as knowing that they do have support, and also that it's not easy becoming a CNA, and it may keep them more motivated to know that they have that financial help from donors and from the Boys and Girls Club to help them with that. And with having someone into a career field as vast as healthcare, you will probably see more benefit and more good out of that with having that kind of career field and also support from the Boys and Girls Club. So with their help, all that can be possible.